Hello, good morning, dear students. Your medical English teacher again in another course, and welcome to the 12th and 13th lesson. Today we will see what is pain, how to deal with it, and what are the symptoms and some vital signs in our bodies in case of we are ill or injured. So to start, we will see a small introduction about management of pain and physical symptoms. Perhaps one of the greatest concerns of patients who are ill or nearing to the end of life is pain or discomfort. Most terminal illnesses are associated with one or more physical manifestations of discomfort. For instance, patients with cancer usually have some type of pain, and patients with a chronic pulmonary disease suffer from breathlessness, which means the lack of the act of breathing. Pain is a signal, in your nervous system that something may be wrong. It is an unpleasant feeling, such as prick, tingle, sting, burn, or ache. Pain may be sharp or dull. It may come or go, or it can be constant or stable, stay with us for a long time. So we will see together types of pain. Pain is usually classified in terms of its psychological mechanism. We have somatic, visceral, or neuropathic pain, and it is temporal pattern. It is important for the clinician to understand what type of pain is involved in order to be able to tailor the assessment and interventions for the patient. So, the type of pain is really important for the detection of assessment or to make an intervention for a nurse. Somatic pain, for example, also known as nociceptive pain, is often well localized to one area, usually with the deep musculoskeletal tissues, which means muscles and bones. Bone pain is an example of somatic pain. Visceral pain, which means that the pain is existing inside our bodies rather than outside, like the somatic pain. Visceral pain is described as deep squeezing or pressure, and it is not as well localized to one area, so it has different areas that may be found in. It is often associated with the compression or stretching of thoracic or abdominal viscera. Pancreatic or liver cancer often causes this type of pain. So as we have mentioned before, visceral pain is concerned with the inside or the interior of the body. Lastly, neuropathic pain associated with illness or injury to the peripheral or central nervous system, such as tumor pressing on a specific nerve in patients with cancer. Neuropathic pain is described as sharp, shooting or burning pain. Pain also can be classified in terms of temporal pattern. Patients can have both acute and chronic. So we have two types of classification of the pain. We either classify it for it is interior or exterior, or according to the time, like here the case acute or chronic. Pain with more than one type or location of affection. Acute pain is best defined by its onset. For the most part, the source of pain can be identified and is often accompanied by other psychological signs and symptoms, such as trauma and the affected area. Acute pain often comes on suddenly from a well-identified cause. So the difference here that the acute pain we don't know its localization, while for the chronic pain we know its localization and we have dealt with it before. It is typically short-lived, meaning that once the underlying problem is resolved or anesthesia is initiated, the pain usually resolves. That's what we have mentioned before about acute and the chronic pain. So the chronic pain lasts more than the acute pain. So there are several ways to categorize pain. One is to separate it into acute and the chronic pain. Acute pain typically comes on suddenly, while the chronic lasts with us, as I have mentioned before. Chronic pain lasts longer, while acute pain lasts less. So, with a long-term illness, In some cases, such as fibromyalgia, it is one of the defining characteristics of disease. Chronic pain can be the result of damaged tissue, but very often is attributable to nerve damage. Both acute and chronic pain can be debilitating, and both can affect and be affected by person's state of mind. So, here, the psychological side plays an important role to the treatment of this type of pains. Moving now to the assessment of pain. A thorough and comprehensive assessment of pain is by far one of the important skills that nurses who care for patients nearing the end of life should possess. So, nurses should know how to deal with pain exactly. As mentioned before, pain is one of the most feared symptoms, but also one that can be managed well following a thorough assessment and pain management plan. While there are a plethora of formal pain assessment tools that are used in practice, we will describe the necessary components of any good pain assessment plan. Terminology. First, as clinicians, it is important to remember that patients may not always use the term pain to identify their pain or discomfort. So, terminology is about how to reword or to rephrase our expressions to transmit the message to the patients correctly. So, there are some patients who are scared maybe or fear of talking about their pain. Nurse here is obligated to reformulate their expressions to transmit the message or to ask about any pain or localization of a pain or either a symptom. For example, here, a nurse asks their patient a general question such as, "Mr. Smith, are you having any pain today?" He replies, of course, no. But when based on the objective signs the nurse is observing, so after looking at the documentation, nurse really find that there is something. They assess that he is having some type of discomfort. The nurse could then rephrase the question as, "Mr. Smith, I understand you are not having any pain, but I notice that you are holding onto your left arm and wincing when you move. Are you having any discomfort or soreness in that area?" A more direct question here is needed or more explicit, so that incorporates your observation as well as using different terms for pain. So here, by rewriting or reformulating our type of question, you will be able easily to communicate with the patient and get the result you want. Moving now to the current and usual pain experience. So, after detecting and rephrasing your expression, you need to deal with pain. So, the nurse needs to gather all the necessary information about the pain. They will need to understand the patient's current pain level and their usual pain experience. This may differ and especially important for those living with some type of chronic pain. What is their pain like today, and how is that pain in relation to what they usually experience? If the nurse is regularly assigned to this particular patient, they will become familiar with their usual pain experience. So all these factors help the nurse to identify and deal with the pain correctly. So the next step is to localize the pain. The nurse needs to access the site where the patient is experiencing pain. This could be multiple locations, depending on the patient. The nurse will need to evaluate each site as a separate location, if applicable, for remaining assessment questions. So by asking and following the instructions, you will find the location of the pain easily. The intensity or severity of pain is often obtained in numeric format, such as on a scale from 0 to 10. So when you have a no degree that means that you have no pain. So by raising the number from 1 to 3, the degree of pain starts to rise also. This is because they might not have ever been informed about this scale before, so nurses should take attention to this scale, which is from 0 to 10. If the patient is deemed to have severe cognitive impairment, then another alternative form of pain intensity rating will have to be used. So here the point is that you are not obliged to follow this scale from 0 to 10. So if the pain is inconstant or it changes its degree, you can use the scale you want. The quality. The quality of pain refers to a description about what the patient feels like. What kind of pain is it? It is sharp or dull? It is aching or squeezing? Does the pain stay in that location or change it? This rating can be very helpful in understanding the type of pain involved, somatic, visceral, or neuropathic, and initiating the most effective pharmacological intervention for that specific type of pain. So the previous elements besides the quality help us to identify and treat the pain correctly in the perfect way. The duration also is an important factor. It is important to understand how long the patient has experienced this pain, of course, and whether it is a new or old. It is a chronic or acute. Why do signs and symptoms matter? Many people use the word sign and symptom interchangeably. However, there is a big difference or an important difference between the two elements. Any objective evidence of disease such as skin rash or cough is a sign. A doctor, family members, and the individual experiencing the signs can identify this. Later on, we will see what is the difference between a sign and symptom. However, less obvious breaks in normal function, such as a stomach ache, lower back pain, and fatigue, are symptoms. So signs do appear in our bodies, while pain is inside our body. Sign versus symptom. The key difference between the sign and symptom is about or is concerned with the person who observes the effect. For example, if you have a rash here in your face, it could be a sign or it could be a symptom or both, and that's depending on the person who is observing that. If the patient notices the rash, so it is a symptom. If the doctor or the nurse or any clinician observes that rash, so it is a sign. If both the patient and the doctor observe that, so it is either a sign or a symptom. Regardless of who notices that a system or body part is not functioning normally, signs and symptoms are the body's ways, letting a person know that not everything is running smoothly. Some signs and symptoms need to be followed by a medical professional, while others may completely resolve without treatment. Since the 18th century, medical science has come on leaps and bounds in helping physicians clearly identifying signs. A range of devices is now available to help doctors to identify and analyze signs and symptoms. These include, there are the most important instrument or tools that you need. So, stethoscope is a doctor can use this to listen to the sounds of heart and lungs. Spirometer, this helps the measure of lung function. Ophthalmoscope, an eye specialist may use to examine the inside of eye. X-ray imaging, this can show damage to the bones. And finally, the sphygmomanometer. This is a device that fits around the arm and measures the blood pressure. And I think you are famous with those instruments. So, symptoms. There are three main types of symptoms. We have remitting symptoms, chronic symptoms, and relapsing symptoms. Starting by, we will see remitting symptoms. When symptoms improve or resolve completely, they are known as remitting symptoms. For example, symptoms of the common or the usual cold or influenza, they come and go, and thus is a remitting symptom. We have also chronic symptoms. These are long-lasting or recurrent symptoms. Chronic symptoms are often seen in ongoing conditions, such as diabetes, asthma, or cancer. relapsing symptoms. These are symptoms that have occurred in the past and reoccurred again in the future after they got resolved. Signs. Moving now to the meaning of signs. A medical sign is a physical response, linked medical fact or characteristic that is detected by a physician, a nurse or medical device during the examination of patient. They can often be measured, and this measurement can be central to diagnosing a medical problem. Sometimes a patient may not notice a sign, and it may not seem relevant. However, in the hands of medical care or medical professional, this sign is easily to be identified. So, what are the vital signs? We have four main important vital signs. They are the measurement of the body's most basic functions. The four main vital signs routinely monitored by medical professionals and healthcare providers include the following. Body temperature, as you know, or as usual, 37 degrees is the normal temperature. The pulse rate. The pulse rate is the measurement of the heart rate or the number of times that the heart beats per minute. Respiration rate is the rate of breathing. And finally, the blood pressure. Blood pressure is not considered as a vital sign, but it is often measured along with the vital sign. So, to end up our lesson, we have to say that we have many or some basic elements and important ones we may or we are obliged to follow to easily identify our problem or the pain or symptoms of our patients. That's the end of the lesson today. Hope that you have enjoyed and got the information. Keep yourself safe till we meet next time, inshallah.